February is, of course, Heart Month, as we've talked about in the past few days, a perfect time to learn about your risk of heart disease and the steps you need to take now to help your heart and to get as many individuals as possible to join the battle against heart disease. On this morning's Bronson Health Chat, we welcome Dr. Christopher Rogers from Bronson Advanced Cardiac Healthcare. Dr. Rogers is here to discuss the structural heart program at Bronson. We're going to touch on a few heart conditions, some of which you may be familiar with, some you may not be familiar with, but we welcome Dr. Rogers to our show this morning. How are you?
I'm good. Good morning, Ken.
Good morning. Thanks so much for joining us this morning. Well, let's start with what exactly is the structural heart program at Bronson.
The structural heart program at Bronson is a program designed to help people who have structural heart abnormalities such as valvular disease, rhythm-related issues, and potential communications between the right and the left side of the heart to try to treat those problems non-surgically.
And how do you know that these patients are candidates for this program?
Well, we get a lot of referrals from different specialists. Primary care providers send us their patients when they feel that there's an issue. And then a lot of the patients that we have are patients that are just in our program for other cardiac reasons.
Let's talk about some of these heart conditions that you deal with in this program, starting with aortic stenosis. I hope I'm saying that right. What is that and how does that impact people?
Aortic stenosis, you said it exactly correctly. Aortic stenosis is thickening of the aortic valve. The aortic valve is the last valve that all the blood flow with oxygen in it gets pumped through to supply your body with all that it needs to live. As we age, and in some patients are born with an abnormal valve, that valve can tend to thicken, and that thickening restricts and prevents the leaflets from opening up well or easily, and that creates a lot of strain and stress on the heart. Those patients start to develop symptoms of shortness of breath or chest discomfort, profound fatigue, and sometimes they have passing out episodes which can be related to that valvular problem.
We're talking with Dr. Christopher Rogers from Bronson Advanced Cardiac Healthcare on our Bronson Health Chat segment this week, talking about the structural heart program at Bronson Healthcare. Leaking heart valves. Now, there are a number of people who are impacted by this. For some, it's a relatively minor thing, but not so for everyone. Tell us a little bit about that, what it is, and who's a candidate for a procedure.
You know, some of those aortic valve stenosis patients, as they develop symptoms and we evaluate the valve, if it becomes significant enough, then we would use ultrasound to screen and follow them, and then based on their symptoms, we would make a plan as to what the appropriate timing would be for repair of that problem. And then we discuss it as a heart team that includes our heart surgeons, the interventional cardiologists, and the patient and family. And once we've decided that they may be a better candidate for a transcatheter aortic valve as opposed to a surgical aortic valve, we would make a plan to complete that for them to try to help them to have a better quality of life and to live longer.
Well, Doctor, another part of the program is a Septal occluder device. And again, yes. I hope I'm doing okay on that term. What is that?
Yes, you're doing great. A Septal occluder device is used when patients have a communication between the right and the left side of their heart. The right and the left side of the heart are supposed to be completely separate so that unoxygenated blood flows to the right side of the heart, gets pumped to the lungs, and then oxygenated blood gets pumped to the left side of the heart, and then all of that blood is supposed to supply your body with what it needs. People who have a communication, a large enough communication, that can develop, create problems with strain on the right side of the heart and potential rhythm problems, and those should be closed for that reason. Other patients have a small communication, about 25 to 30% of the patients that walk around every day can have a small communication between the upper two chambers of the heart, and in a small percentage of those patients, that can lead to stroke or mini strokes. And if people have a stroke or a mini stroke and the neurologist can't find any other underlying culprit or mechanism for that to happen, if they have an ultrasound of the heart and a communication is defined, then the structural heart team meets with the neurology team, and we determine which patients would be appropriate for closure of those communications.
And we want to touch finally on something that I'm sure a lot of people have heard about because you see this on TV all the time, discussions and commercials about treating AFib or atrial fibrillation, and it's and you hear actors talking about its relationship to stroke. Tell us what we're learning about on television about this.
Sure. Atrial fibrillation is something that actually is getting more and more prevalent as the population ages. And atrial fibrillation is a very chaotic heart rhythm from the upper chambers of the heart. And that chaotic heart rhythm can create sluggish blood flow, and then sluggish blood flow can form clots. And most clots occur in an area on the left upper chamber, or in the left upper chamber, called the left atrial appendage. And people who develop atrial fibrillation, depending on their risks, should be on a true blood thinner. Most people are familiar with Coumadin, but there are now several other blood thinners that those patients should be on. Unfortunately, some of those patients develop bleeding complications or have other risks that place them at too high a risk to maintain therapy with a blood thinner. And in those select patients, there is now a new device called the Watchman Device. It's the only device that's approved in the U.S. as of right now. And that's a device that we can place in the left atrial appendage. And once we've released it and removed all of our hardware to implant that device there, their bodies will seal off that left atrial appendage, and then that reduces their risk of stroke. And over time, with that in place and a baby aspirin, their risk of stroke is very similar to them taking a blood thinner on a regular basis. And then, of course, we've relieved them from the potential complications of being on a blood thinner lifelong. And 90% of strokes related to atrial fibrillation come from this area called the left atrial appendage. So this therapy has been very effective.
Well, Dr. Rogers, we talked about a number of aspects of the structural heart program at Bronson Healthcare. If listeners want to learn a little bit more or find out about the potential conditions, what should they do?
Well, first, they should talk with their primary care providers to see if they have symptoms that would be concerning. And then once their primary providers have listened to their issues or their problems, evaluation and management, that ultrasound or referral to the cardiology group would be the initiation of that process. And then we would take it from there and help to manage and work through the issues with the patient and family.
On our Bronson Health Chat this week on WKZO, we've been talking about the structural heart program at Bronson Healthcare with Dr. Christopher Rogers from Bronson Advanced Cardiac Healthcare. And thank you so much for sharing this information with us this morning.
Ken, thank you. I hope you have a great day.
And you as well. On News Radio 590 and 106.9 FM, WKZO.